Hi, I'm Dr. David Perlmutter. I practice in upstate New York in Albany and Clifton Park. I'm a graduate of Harvard College, University of Rochester Medical School, and Wills Eye Hospital residency program and Geisinger Medical Center Medical Retina Fellowship. We take care of a lot of patients with macular degeneration, as many retina specialists do. I see a lot of medical retina patients, but I also have a little bit of a unique lens because I still do anterior segment surgery. Today, we're going to be listening to some patient encounters. You'll hear a patient and you'll hear a doctor speaking, and we'll be pausing it, and you'll get to hear my reaction as I listen to the patient encounter and what I might be thinking in my own clinic.
Hi, Mary. What brings you in today?
Well, my eye doctor wanted me to see you as soon as I could, and because my macular degeneration is worsening. But honestly, I feel like my vision is actually pretty good. It's not what it was, of course, and my kids tease me because I have to use the flashlight on my phone to read in dim lighting.
So there are a couple really important things here that we've heard just in the beginning. The patient already knows the name of the disease, and that means that the referring doctor has at least done some education with vocabulary, basic terminology, and a little bit of information about the disease. It's so important that patients come in with some knowledge of their disease. That way they can spend a little time researching it, and there's only so much that you can discuss in a visit that a patient can retain. If a patient comes in and has absolutely no background knowledge, it's hard to get into a full discussion and educate the patient. But if the patient has a little bit of background knowledge coming in, then it gives us the leeway of launching into a little more information, a little more detail, and hopefully having the patient walk away with a more full understanding of what's going on. The second part is that the patient has acknowledged that there's a visual complaint. She's having a little bit more trouble than she used to, but she's also expressing some hesitation. So she's sort of explaining it away, saying it might be due to age. And as the doctor, you want to make sure you hear that from the patient, because at the same time she's expressing hesitancy about doing anything. So already in this visit, I'm thinking that this is more likely an educational visit and that we're not launching into treatment right away, and that this is a patient who needs a little time to understand the disease, see some images, and help us develop a relationship going forward.
I figured it was mostly because of my old age. My doctor said I was developing what was called geographic atrophy and was concerned about me losing my vision and told me it was important I came in as quickly as possible. He did talk about different treatments like injections to help stop it from getting worse, and so that's why I'm here.
It's great that the referring doctor mentioned the idea of treatment, especially that it could be an injection of medication into the eye, because the patient now has some terminology, but also it takes a lot for a patient to wrap their mind around the idea that there may be a treatment with an injection into the eye, and it's scary, and you can understand why it would be scary. This gives the patient some time to think about it. More than likely, this patient has a friend or a family member who's had it done before, and hopefully can tell them that it's really not that bad to go through. But it's tough as the doctor to be breaking that news for the first time to a patient who has absolutely no background in the disease and also didn't realize what treatment for the disease might entail. So it's extremely helpful that the referring doctor provided some education here and allowed the patient to mentally prepare for the idea of what treatment might entail for macular degeneration.
Well, I'm happy that your doctor sent you in, and he's right. If your macular degeneration has developed into geographic atrophy, it means that large clusters of cells in your retina, or what we call lesions, are no longer working properly and will become increasingly larger blind spots. These blind spots can continue to grow and eventually have a major impact on your central vision. So we're going to perform some tests to see what's going on, and then we can decide on treatment from there.
So one of the biggest challenges in an exam room is how do you explain something to a patient that's complex and simplify it so that when they walk away, they understand what's going on. So we all have our ways of doing this. For macular degeneration, it's really helpful, I find, to have pictures. So we can talk about the retina, we can talk about the macula, but most of us don't have our full eye anatomy knowledge coming into an exam. So being able to show the patient a model of the eyeball, show them that the macula just means the center part of their retina, and allow them to understand what we're talking about, and then show the pictures on the actual computer screen so that they can see where the geographic atrophy lesions are, and also walk them through the idea that many people have macular degeneration but don't get this far along. So we talk about the whole spectrum of the disease. We talk about how most people walking around with some macular degeneration are not symptomatic and don't have any issues from it, but that in this scenario, when a patient starts to develop geographic atrophy, we're getting to a point where they may become symptomatic, and then this patient, already realizes that she does have some symptoms, and it'll allow her to see those, exactly what's going on the screen. And then also at future visits, she'll have an understanding of what we're looking at for progression. And that will help her wrap her mind around, what the doctor's about to talk about, which is the treatment options.
Your doctor was also right. We can use injections to slow down the progression of the disease, but let's take this one step at a time and start by looking at the back of your eyes to see what we're dealing with.
So in this exam scenario, the doctor hasn't done the testing yet. Most of the time when the patient's in the room with us, we have the testing on the screen for them to see, but the doctor does a good job of mentioning the treatment. Patients are all different. Some patients come in already knowing exactly what they want to do with the visit, whether they want treatment, whether they don't want treatment. But when patients are really looking to us for advice, it's important that we start to talk about the treatment and then also develop that relationship, because sometimes you bring it up and the patient wants to go ahead and do this as fast as possible, and other times you're just establishing a relationship and helping educate them about the disease to help them make a decision that they're not quite ready for yet. But in this scenario, the most important points that the doctor brings up, which are huge, is that is education on the disease, and then also the discussion about slowing the disease down. And mentioning we can't reverse things, we can't stop any progression, but we do have medication options that can be injected to slow the disease down. So that concludes that patient scenario, and we'll move on to the next patient scenario.